important day to recognize and celebrate our cancer survivors as well as inspire those recently diagnosed. Here today to talk about the importance of this milestone is Dr. Andrew Salner, the medical director of the Hartford Healthcare Cancer Institute. Doctor, welcome back.
Thank you, Lisa. Great to be with you.
Great to have you. So who is National Cancer Survivor Day for?
National Cancer Survivors Day is really for the 17 million cancer survivors in the United States, Lisa, and that number, due to earlier diagnosis and improved treatment, should grow to about 22 million over the next 5 years.
All right, Doctor, why is it important to celebrate life after cancer?
Cancer is very common. About 43% of us will get a diagnosis during our lifetime, and the 5-year survivorship has increased. Less than 50% survived the disease in 1975, 60% in 1995. Nearly 70% of people survive the disease today, Lisa. And that journey through a diagnosis and treatment is challenging. It's challenging for the patient, for their family, for their caregivers, and it can result in numerous issues that patients and families face even for months or years to come, including physical, emotional, social, spiritual, psychological issues. So Cancer Survivors Day really celebrates that difficult journey that patients have gone through and continue to go through after a cancer diagnosis.
And Doctor, tell us a little bit about why we're seeing those improving numbers.
Well, I think two main reasons. One is we're definitely diagnosing cancer earlier when it's more curable, and that is great news. And number two, our treatments have gotten much better in the last number of years. We still have a ways to go, but I think the results continue to get better and better as we come up with new molecular and genomic and other improvements and discoveries, which really improve the results from a cancer diagnosis.
All right, and final question, talk about how important it is to have a support system as a cancer patient.
It's crucial, Lisa, because a cancer journey is stressful. It frequently takes people away from their usual routine of their family life and their work life, and they need a lot of support. They need a support from their family and friends. They need a support from their colleagues at work. They need support from their medical care team, their cancer care team that's going to take care of them. And they should not hesitate to ask for help if they need a meal or if they need a ride or if they need someone to cover for one of their kids' events. That's what we do as friends. People do it for us, and we need to do it for others too. So support is really crucial.
And maybe we can encourage people watching to make those routine screening appointments. I know a lot of people fell behind during COVID, but whether it's colonoscopy, breast exam, those are the key screenings. All right, Dr. Andrew Salner, thank you so much for joining us.
My pleasure.